Abortion has been a taboo topic in the last 30 to 40 years. However, in the last 3 to 4 years, abortion has been a very hot topic politically, and in our field of social work, especially. There are two types of abortion that women can get: medical and surgical abortions. However, medical abortions are the most popular, and they are continuing to be trending and becoming more popular with women, especially women um, in their teens and women in their 20s. This is because um, women can get the medical abortions by all sorts of different providers. Their doctors, and even on the internet, you can get the medical abortion pills from different internet providers. The medical abortion is just two sets of pills that women take at different times. They take the first set, and then about a day later, you take the second set of pills. A lot of times, the medical abortion is done at home without doctor or medical supervision. There is, however, abortion pill reversal, and this is provided by the American Pregnancy Association. This can stop or reverse the abortion if it is caught in time. This program, done and provided by the American Pregnancy Association, is it's a pill that the women take in between the two set of abortion pills. There is a short window that the women can take this pill reversal, and it will stop the hormones and the medication from enacting the abortion, hence the abortion pill reversal. In 2019, Planned Parenthood reported roughly around 300,000 abortions in their clinics. This was about a 4% increase from 2018. If this increase continues and the abortions continue, many of our women will continue to have the abortions and the risk and trauma that come along with those abortions. As I said in the beginning, abortion has been a taboo topic, and with all taboo and politically charged topics, there are two sides to every situation and conversation. And so the first side that we will discuss is the conservative and pro-life side, and then we will talk about the liberal and pro-choice side. With the conservative and pro-life side of the abortion conversation, I'm going to have 3 points, and then I'll have 3 points for the other side. So the pro-life, under the pro-life side of in the argument, there is the ultrasound law that women in some states, there's an ultrasound law that requires women to get an ultrasound before they have the abortion, and this is a matter of safety and protection for the women, because sometimes women could have twins, and if they go to get an abortion, and say they go to get a surgical abortion, and it is unknown to the medical provider or the woman getting the abortion that she has twins, because she did not have an ultrasound and she is unaware. They are only looking for one fetus, and so when they do the surgical abortion and they receive one fetus, they are done, and then that causes harm to the mother because there's still a fetus in her womb. And so it would just cause health concerns for the mother. So an ultrasound could be very beneficial to the mother in terms of health factors. And there's also the chance that the pregnancy could be it could be an ectopic pregnancy, which is when the pregnancy is in the tubes. It didn't get to the uterus, and that is very dangerous as well. And so just risk factors and health concerns for the mother, and an ultrasound could make the mother and medical providers aware of those things before going in for an abortion, and could potentially save the mother some harm. Another thing I just want to touch on is the Women's Right to Know Act. This act ensures that all providers giving abortions let women know all the risk factors before they decide on an abortion. And so this act makes sure that providers let women know of all risk factors, emotionally, physically, psychologically. And they're aware of what the procedure will be like. A lot of women have reported that they did not know what they were getting into after they had the abortion. And so this act gets rid of the unknown and lets women know exactly what they are getting into, and so they can decide yes or no, this is what I want to do, but they are aware this is what I'm doing, and I'm signing off on that. Another thing is mental health and substance use and abuse of women who have had a termination. Studies have shown that women who have had a termination has been directly affected their mental health and their substance use. And many studies have shown that their termination is a direct correlation with depression and anxiety and PTSD and alcohol use. And so just something to be aware of, and another reason for people to be pro-life and for that argument. And so moving on to the other side of the argument, which is pro-choice. The Reproductive Health Care Act, which is the act that says government should not be involved in women's healthcare decisions because women have the right to make their own decisions, and women are in charge of their own bodies, and no government, no ruling body should decide anything for women. And so this act kind of takes away the right of government and lets women choose for themselves. Another thing is healthcare shouldn't be limited or have restrictions, meaning, for instance, doctors should not be the only ones able to perform abortion. So nurse practitioners, and for instance, the medical abortions, women are able to get them in multiple places, in multiple facets. And so, and another instance is the ultrasound law. On the other side of the argument is that kind of limits women to healthcare and access because it's one step that they have to take before they get the abortion. So women should not be limited. They should just be able to do what they please with their health and with their free health care and everything like that. And so there should be no limitations. There should be no restrictions. It should just be any other procedure. You just go and get it done like you please. There should be no preliminary things or preliminary steps to get it done. And then another big thing to note is that women who felt pressured or that the decision wasn't theirs report more negative emotional reactions. And so this just kind of points out that those who felt that they were pressured to do something or that the choice wasn't theirs, they had a more negative reaction or they had a deeper emotional experience. And so this goes along with women should have the right to choose, and women should be their own governing body of their body. And so we should not have any say in how women get access to care or what women do with their bodies. They should just be free to do what they want to do. And I know this is a tough topic and can be tricky, but there are two very charged sides of this topic, but I think as social workers we have to know and be aware of both sides and be willing to hear both sides out and listen to our clients, especially when they are fighting for themselves and fighting for their beliefs. So thank you.